Welcome to the Dr. Carolyn Coker-Ross Show, awakening your full potential and expanding your understanding of how to live fully and joyfully by making conscious choices that promote and maintain vitality in all areas of your life. Now here's your host, Dr. Carolyn Coker-Ross. Please be sure to listen to this episode in an environment that is safe. Do not listen to this recording while driving a car or operating any kind of machinery.
Welcome to the Vital Life Radio. This is September is Prostate Cancer Awareness Month, and 1 in every 6 men will be diagnosed with prostate cancer in his lifetime, which affects families as well as the patients themselves. And in honor of Prostate Cancer Awareness Month, my special guest today is Dr. Aaron Katz. Dr. Katz is the director of the Center of Holistic Urology and also an associate professor of Clinical Urology at Columbia University, where he's been a faculty member since 1993. Dr. Katz is one of the top doctors in the country in integrative treatments and has recently been approved as the first doctor in the country to work with an FDA-approved herbal approach in prostate cancer prevention. He appears on IMUS in the morning and also addresses prostate cancer issues on his weekly WABC radio show, Katz's Corner. So welcome to the show, Dr. Katz.
Thank you very much for having me. It's great to be here with you.
Yeah, I understand you have a new book coming out this month called The Definitive Guide to Prostate Cancer.
Yes, Rodale Press is the publisher, and it is available now on Amazon.com. The Definitive Guide to Prostate Cancer, everything from integrative approaches to the conventional treatments for those men that have been either newly diagnosed with prostate cancer and are looking for an option, or for those men that have had prostate cancer and have had a relapse, which would be typically defined as a rising PSA. The PSA is the blood test that indicates prostate cancer. So the book really goes through if you have prostate cancer, what it means, what stage of cancer you might be in, and what are the treatments, the conventional treatments like surgery, radiation, and cryotherapy, as well as what I feel a very important mode of therapy, which is active holistic surveillance, which is really for a majority of men with low-risk prostate cancer, where diet and herbal supplements may be enough for these men where they can be spared the undergoing radiation or surgery.
I've been hearing a lot more, I think most of us have, about prostate cancer in the media. Is that because the incidence of prostate cancer is increasing?
Yeah, it probably is, and we are seeing, because of the widespread use of the PSA test, more and more patients that are diagnosed at a younger age. In fact, you mentioned my weekly radio show, Katz's Corner on WABC. We had a guest this week who was diagnosed at the age of 35 with prostate cancer. And the only reason that he was diagnosed, interestingly, was that when he went for his routine test, for his physical, his doctor just, happened to check off the PSA, and then they called him and said, hey, your blood test came back high for your prostate, and he doesn't have a family history. He's not African American. Those are fairly known risk factors for prostate cancer. So here he was. He has no symptoms at all. They repeated the test. It certainly was high, and then he went for the next step, which would be a biopsy. And it did confirm prostate cancer.
So was that a complete accident then, that he was, because we don't routinely screen men of that age for prostate cancer, correct?
No, that's correct. We don't. And, typically we start screening in this country at the age of 50, although, there is controversy about that now, and maybe we should be starting it at earlier, at age 40, especially for those men, I think, that are African American or that have a strong family history. If your brother has cancer of the prostate or your father, you probably should have the test at least once, starting at the age of 40, then maybe 45, and then 50, because really it's just a blood test, but it should be also combined with a digital exam, a finger exam, so that the doctor can feel the prostate and get an evaluation of the size of the prostate, because a larger prostate, and although it's not cancer, but if it increases in size, can make the PSA bounce up too. It doesn't have to be also from, necessarily from prostate cancer.
Now, and the guest who called into your show, did the biopsy show that he did have cancer?
It did. It did show he has cancer. He actually started a foundation for this called the Blue Cure Foundation. And he came to see me. He went to a lot of different doctors and was recommended to have either radiation or surgery. And, a lot of the doctors, when patients get diagnosed at a young age, they feel that the prostate should be removed. And he decided to go on to the active holistic surveillance, one that we define and outline in my book. And his recent biopsy, which he just, told us, showed no cancer. He had another biopsy, and after he went on our diet and supplements, there was no cancer that was seen, which is great news for him.
Yeah.
And, although the biopsy, is a sampling, and, as I told him that I think it's great that it showed no cancer, and but, it is possible that he still may have prostate cancer, but it may be very small now and may have been missed on the biopsy. So, the biopsies have some sampling error in and of themselves.
Does the PSA, is that an accurate way to diagnose prostate cancer along with the digital exam? Because I've heard some controversy about, people may have an elevated PSA, as you said, but not actually have cancer and then have to undergo more procedures before.
You're right. You're absolutely right. It's not 100% accurate, no way. But it's the best test that we have right now. There are some other newer tests that I think can also be helpful. There's a way of looking at prostate cancer in the urine, where we massage the prostate and then send the urine, and we can look at the specific gene that's turned on in prostate cancer, and we can detect that in the urine. And I often do that. It's called a PCA3 test, and talk about this as well in the book. And I think doctors should be doing this more routinely. It is a standard way of evaluating and seeing if the PSA is elevated. Is it because there's cancer? And this gene test, it's just a urine test. There's a number of reference laboratories throughout the country that will do the PCA3. So I think that's helpful. Also,
is that
we look
more specific than the PSA? Does it?
It can be more informative than the PSA. Yes. Mm-hmm. Yes, it can. So I always do that test in my office. I do the PSA first, then I do the digital exam, and then I have the patient urinate, and we send the urine out for this PCA3 urine test. And I find that can be helpful. The other thing that can be helpful is that the PSA, we know, exists in two forms in the bloodstream, kind of like a good and bad PSA, almost like, good and bad cholesterol. You have your total cholesterol, and you have your LDL and your HDL. Well, with PSA, we have the same thing. We have total PSA, and then we have good and bad PSA. It's called free and bound PSA, and we can tell you the ratio of those PSAs. Most of the laboratories nowadays will do that, and it'll, again, give us more information about the PSA, and does the patient need to take that next step, which is the biopsy? And the biopsy is not the worst thing in the world. It's an outpatient thing. It's done in the doctor's office. It takes 10 or 15 minutes. It's done with local anesthetic. But it is a procedure, and, we'd like to reduce the number of unnecessary biopsies in this country. And I think some of these, newer tests of looking at PSA can be helpful.
So what is the ratio of the free and bound? What ratio would indicate?
Well, it's a good question, and the cutoff value looks to be around 15%. So if your free PSA is lower than 15%, that increases your risk of prostate cancer. So lower free PSA, higher rates of prostate cancer.
Okay.
Yeah, so if you go down below 10%, then I would say that patient has about an 80 or 90% chance of having prostate cancer. The other thing that we do is we do an ultrasound in the office, and I think, again, this can be helpful. Not a biopsy necessarily, just an ultrasound of the prostate. You take a small probe, it's inserted into the rectum, and you can see the prostate very well, and you can calculate and determine the patient's prostate size. And then you can determine if the patient's PSA is appropriate for that patient's prostate size, because if you have a patient that has a very large prostate, as I said, their PSA may be elevated, and that may be normal PSA for that patient just because he has a large prostate. Why patients get large prostates, we still don't know the answer to that. It's probably something genetics, it may be environment, it may be diet. But there are many patients, even in their 40s and 50s, that their prostates tend to grow, bumps up their PSA, and without knowing the size beforehand, a doctor may just go ahead and do a straight biopsy. And I like to know that concept. That concept is called PSA density, where we divide the PSA by the prostate volume. And I think, again, it can be a very helpful tool in determining who should have a biopsy or who should not.
We have a couple of minutes now before our first break, and I saw in some of your literature that you've written that prostate cancer really is preventable and probably curable if it's detected early.
Yes, that's absolutely right. And, I think that a number of the herbal supplements that we've been studying and have included in our active holistic surveillance program, which we talk about in the book, can be helpful in prevention. There have been a number of studies using drugs to try to prevent prostate cancer that reduce the hormone level, a specific hormone level in the male body. And there's been some controversy about the drugs because it does reduce prostate cancer, but it can also have some side effects for men, some sexual side effects, because you're lowering a specific hormone level in the body, which may reduce the man's ability to have an erection or to produce semen. Mm-hmm. So we've taken on more of an herbal or a natural approach and looking at ways of interfering with inflammation, because we believe, like many other cancers today, that the inflammatory cascade, inflammation, is directly linked to the development of cancers. And I think that that's probably true for prostate cancer. And so we're looking at a number of different herbal compounds, one that we've studied and published on at our center called Zyflamend. Zyflamend is an herbal compound. It contains 8 different herbs in it, and each of the herbs have very weak anti-inflammatory properties. And we've done some studies in our laboratory. We've also conducted a clinical trial and about to do an FDA trial now with this. That in our early studies, both laboratory and in the patients, did show that in men with precancerous conditions of the prostate, we could eliminate those in many of these men.
I have my special guest, Dr. Aaron Katz, who's the director of the Center of Holistic Urology at Columbia University. He's also the author of a new book that just came out or is just coming out called The Definitive Guide to Prostate Cancer, Everything You Need to Know About Conventional and Integrative Therapies. So, Dr. Katz, in my as an integrative physician, in my experience working with other physicians, it's not very common to find someone in urology who practices integrative therapies. How did you first get interested in that area?
Yeah, you're right. It's not. And, I went through 4 years of medical school and here in the United States, and then I did a urology residency, which was 6 years. And throughout those, and then I did a 2-year oncology fellowship at Columbia University. And through my entire training, the amount of time that was spent on nutrition and herbal compounds was virtually zero. I'm sure that you can imagine. Nothing throughout that. And then when I started and I joined the faculty at Columbia University, within the first few months, I got a phone call from the late Dr. Atkins, who had an integrative, the Atkins Center, complementary medicine, which I knew nothing about, in Manhattan. And he said, we're seeing a lot of prostate cancer patients and we're treating them, but we really need a urologist. Can you come down and, help us sort these patients out and evaluate them? And I said, well, sure, I'm not that busy. I just started my practice here at Columbia. I'll go down. So every Tuesday I would go down for about 4 years there. And what was amazing, it really opened up my eyes because, there were patients there that were maintaining and managing their urinary symptoms, their PSA, with herbs and diet, where if they were, seen at Columbia, I would be operating on them or biopsying them. And I said, there's got to be something to this. I mean, I knew nothing even about Saw Palmetto or beta-cytosterol or some of the more common herbal things that these patients were on that, told me that their PSA had gone down or that their urinary symptoms were improving. So I said, this is really incredible. I need to take a further look at this And so that's when in 1998 I opened up, I think, the first, holistic urology center in the country, if not in the world, to do basic science laboratory investigations on these herbs, as well as clinical trials in men. If we found that something in the lab worked, let's try it in our male patients. And
was there another reason that, because some of the conventional therapies for prostate cancer have pretty serious side effects?
They certainly do.
Okay.
That's absolutely right. And, there have been some advances in the way that we're removing the prostate with robotic surgery, and that has improved our ability to look at the nerve bundles and prevent men from getting, erectile dysfunction. But a significant number of men, even in expert hands with the robot, still wind up with urinary leakage, with erectile dysfunction. And, the question, I think, still bears whether or not these men need to undergo surgery. And, with radiation, of course, there's all kinds of, early toxicity as well as delayed toxicity with radiation. Secondary cancers can develop, bladder cancers can develop, rectal cancers can develop, urinary problems can develop. And again, the question bears, does a man with a very small prostate cancer need to go through 9 weeks of radiation? And my feeling is they don't. They absolutely don't. And I'm sorry to say this, and even I'll say this on the air, but a lot of it is economics. A lot of it is driven by cancer being a big business, a big dollar business. And
doctors don't get paid to give herbs; they get paid to do surgery. And hospitals too.
That's right. The robot costs about $1.8 million, and a lot of the hospitals felt like they had to buy the robot, and then the doctors feel like they have to fill the beds. And the same thing with radiation. A lot of the urologists have band together, bought a radiation center, and every man with a small little Gleason 6 non-lethal prostate cancer gets sent over for 9 weeks of radiation. And it's unfortunate. And there's nothing being done out there, in my mind, about prevention and looking at diet in a serious way. More and more urologists are becoming more open-minded and are recommending even weight loss, because we found that there's a lot of studies that show that if you put a patient on a low fat diet and reduce the red meat in their diet, you can modulate their PSA. Their PSAs will come down. So, that's really how I got into it.
Tell us about some of the holistic therapies that you've been using at your center and how they've worked, and give us more information about the research that is showing.
Well, one of the therapies I think that we found to be very helpful is acupuncture. And we've hired an acupuncturist, and Jillian has been with us for, I guess, around almost 10 years now. And acupuncture has been terrific to help men with a very common prostate condition, not necessarily prostate cancer, but prostatitis, an inflammation of the prostate, which I believe can be a precancerous condition. And a lot of the men that we see with this prostatitis are in their their 20s, 30s, 40s, younger guys who have this chronic pelvic pain symptoms. And most urologists will give patients antibiotics. They know they don't have an infection. At least they can't find an infection. The urine culture shows no infection. And, a lot of urologists just get frustrated and throw their hands up. We have found acupuncture, an 8-week course of acupuncture once a week where, patients can come into the center and they meet with our acupuncturist, have acupuncture, have acupressure, can really relax the entire lower pelvic muscular area and relieve those spasms. And I think it's more of a pelvic muscle spasm condition than an infection there. So, yes, I think acupuncture, we've published on that. The other thing where acupuncture has been very helpful with prostate cancer is that a lot of men with prostate cancer get put on hormone therapy. And when you go on hormone therapy, you go into a male menopause and you develop hot flashes. And what acupuncture has done is it's causing a reconfiguration, if you will, of the vessels on your skin and significantly reducing the hot flashes. So I think acupuncture is something that I feel very strongly about for many of our patients. It can also help with erections. We found a lot of our patients that have failed Viagra or don't want to go on to Viagra can be helped with that as well. There was a recent study that just came out showing that acupuncture can also help with young men that have premature ejaculation. So I think there's a whole area where acupuncture and urology are going to come together.
That's really exciting, actually.
It really is, because it used to be these two circles, the allopathic and then, the Western and then the Eastern. They were two separate, distinct circles. And I think that these circles are coming together closer and closer. And a lot of it, yes, is patient-driven. A lot of patients don't want to undergo the conventional treatments if they don't have to. And a lot of it is being science-driven. We're seeing more and more papers in excellent peer-reviewed journals that we're publishing, other centers are publishing. Even have major academic centers now like Memorial Sloan Kettering, MD Anderson, Duke, all having these integrative, medical centers in their medical center to treat and evaluate these patients and to do research studies.
Now, you also said at your center, I read that you're doing some mind-body therapies as well.
Yes, we are doing some mind-body therapies. I think that can be helpful to relieve some of the stress that patients undergo when diagnosed with cancer, with pelvic pain, even with women with a condition called interstitial cystitis. That can be helpful. The hot flashes, as I mentioned. And then, of course, there's the whole, diet and supplements. And, our active holistic protocol for men that have prostate cancer that say, wait, do I really need to go and have surgery or radiation right now? Let me, take the Katz protocol. Let me go on the, active holistic surveillance for a while. And if I need treatment later on, okay, fine, but I want to do this now. And I will tell you that an overwhelming number of the patients that go on this protocol that are motivated lose weight, they feel better, their PSAs are stable or reduced. Many times their next biopsies show no cancer. And overall, they have a general sense of well-being. Much of the diet and the supplements that we recommend not only are good for the prostate, but are very good for the heart. They're good for bone health. We improve cardiovascular system. So I think there's a lot of merit, and we're trying to treat the whole body and the whole patient rather than just go in, take out the prostate, and see it later.
Exactly. Well, I read that you're involved in a study using herbs and supplements for chemo prevention. Can you say, I know you've mentioned it a couple of times, can you tell us a little bit more about how this works and Yes,
well, one of the compounds that we've studied quite heavily is called Zyflamend. Zyflamend is available now in the health food stores. It contains 8 different herbs. They're all anti-inflammatory within them. And the way that I really became involved with this was that, again, just listening to my patients who were telling me that their PSAs were going down, and I said, well, what are you taking? Well, I'm not taking any medicine. I said, well, are you taking any herbs? And a lot of the men were saying, well, we're taking this, herbal compound for arthritis,
right,
or my joint pain. And so we said, well, I don't know what's all this about. So we called up the people in Brattleboro, Vermont, who make, the Zyflamend is made by a company called New Chapter. And we studied in the lab. We did show that it was working like an herbal aspirin. And then we evaluated men, and these were men that already had a biopsy, and it didn't show cancer, but it showed a precancerous condition in the prostate. And if nothing was done for these men, then they were going to develop prostate cancer in about 60 to 80% of the time within 6 months. So we put them on the Zyflamend for 18 months and biopsied them every 6 months, and found a significant reduction in prostate cancer detection. So now we've gone to the FDA, and we have FDA approval to do the next phase, which would be a phase 2 study, which would be a larger phase study over the entire country, because the first study was just done at our institution at Columbia University. So we're very excited about this. We're going to enter a lot of patients into this trial, and I think that this is, just paving a new road for us for chemo prevention.
Well, we're going to have to go to break again, but when we come back with Dr. Katz, I want to talk more about the effect of diet on prostate cancer, because there's been a lot of research to show the importance of nutrition. Welcome back to The Vital Life. I'm here with my special guest, Dr. Aaron Katz. He is the author of a new book called The Definitive Guide to Prostate Cancer, Everything You Need to Know About Conventional and Integrative Therapies. He has an integrative medicine center called the Center of Holistic Urology at Columbia University, where he is researching different alternative and conventional therapies for the treatment of prostate cancer. So, Dr. Katz, before the break, we were talking about Zyflamend, which is an over-the-counter anti-inflammatory, which actually has been tested, I believe, head-to-head with Celebrex, the arthritis drug, the COX-2 inhibitor. And you're now finding that it's being helpful in precancerous lesions of the prostate. But what are some of the other herbal remedies that you are finding to be helpful in prostate health?
Well, one of the other studies that we've been involved with is the pomegranate juice trial. Pomegranate, which was originally studied at the UCLA Center for Urology, they did show that when they were given laboratory animals the extract of the pomegranate, that they could interfere with specific cell cycle of the DNA that was involved for prostate cancer growth, and actually reduced PSA as well. Right now, the trial, which just ended, was looking at men that had prostate cancer and their PSA had come back after radiation or surgery. And we were looking at the time that it took for the PSA to double, because what we know about PSA doubling time is that if you extend the PSA doubling time from, let's say, 1 year to 2 years to 4 years, you basically extend your life. Wow. And this was a double-blind, randomized, placebo-controlled trial, which means that the doctors didn't know if the patients were getting the placebo or the pomegranate extract. And the patients didn't know either, and some of the patients were getting placebo in a 3-to-1 ratio. But basically the results were fairly statistically significant, that even at 4 years, when patients were taking the PomX supplement, that they extended their PSA doubling time. So this is, I think, part of our active holistic program, as I was mentioning earlier, that's outlined in the book. So I'm very excited about POM, and I think that patients with prostate cancer for prevention or treatment should be on that. The other compound that we've been studying, whether it's a hormone or a vitamin, is still up for debate, but it's vitamin D, D like David. And we just completed an evaluation of 20,000 of our patients at the Urology Center at Columbia University, and 75% of the patients that we saw in our urology department were deficient in vitamin D by the standard laboratory. And that number goes up if you look at patients with prostate cancer. That's going to be published this month in Journal of Urology. And so I think that all the men that are out there should have a vitamin D evaluation. I recommend 5,000 units a day for our patients, and then get another baseline vitamin D level typically in around 3 months, because you can take too much vitamin D. There is a toxicity, so you have to be very careful about that.
And vitamin D, you're using it as a way to boost the immune system. Is there any specific relationship with prostate cancer?
Yes, there is a specific relationship, and there's a whole tremendous host of laboratory and epidemiological data to show that there are vitamin D receptors on the cancer cell, that if you boost up the vitamin D level in the patient, you can shut down a specific pathway that's involved in cell growth. So this has been well studied in laboratory studies. So I think vitamin D is very important. The other compound to enhance, as you mentioned, enhance the immune system, we've been using a Japanese compound called activated hexose complex, AHCC. AHCC. It's made by a company called Quality of Life Labs out in Sapporo, Japan. And it's a amalgam of 3 or 4 different medicinal Japanese mushrooms. It's widely used in Japan for a whole host of diseases. But we have found that the natural killer cell levels will go up in the patients that are on AHCC. They don't, I just mentioned this patient earlier, that the 35-year-old gentleman was diagnosed with prostate cancer. He told me, in addition to his PSA levels and his negative biopsy after being diagnosed, he's not had any colds or flus. He would typically be on 5 antibiotics every year. He has, over the past year, he's been on no antibiotics at all for any upper respiratory ailments. So I think it's definitely doing something to the immune system, and it can help fight cancer in a natural way. So I think that's another, dietary supplement that we're excited about.
So tell me a little bit about nutrition and how that affects both the risk for prostate cancer and what is the perfect diet for someone who's been diagnosed with prostate cancer.
Well, I think that a lot of the studies are showing, ours included, that a plant-based diet is going to be best for the patient. So a lot of men, though, that are used to eating, 3 or 4 servings of red meat a week, it's going to be difficult for them to switch over to a vegetarian or even a vegan diet. But I try to tell men to eliminate red meat in their diet. I tell men to reduce the fats in their diet, stay away from fried foods, reduce the sugars in your diet. More sugars can promote cancer growth. Reduce your weight. I think that it has to be a combination of diet and exercise. How many times a week are you doing aerobic exercise? You need to do it at least 3, maybe 4 times a week. And with those things, eliminating the red meat, reducing the fried foods, reducing the sugars, adding green tea instead of diet soda or Cokes, go more to green tea, can be all those things I think can be very helpful for the prostate and the heart and other, ailments that men develop. So,
is lycopene still an important nutrient?
Yes, it is. I recommend lycopene. Absolutely. I think that the lycopene, the stewed tomatoes. If you don't want to take the pills, you can take tomatoes, but they have to be stewed tomatoes. Will liberate the most potent carotenoid there is, the lycopene, which has been shown in about 75 studies right now to interfere with prostate growth. So yes, I think lycopene, you can get that from tomatoes. You can get it from watermelon as well, and things like that.
So I know you probably have seen Dr. Andrew Weil's anti-inflammatory diet. Is that, have you seen the anti-inflammatory pyramid that he
Yes.
espouses? Yes. Okay. Is that
mirrors
the kind of
basically
diet
what
that
we're
you're
having.
talking about?
Yes.
Okay. So what about fish in prostate cancer? Is that something that's helpful or neutral?
I think fish can be helpful, especially because of the if you're taking in more sardines or more salmon, wild salmon, Alaska salmon, sardines, to improve also your omega-3 ratio to omega-6 can be helpful. So we do include that in our diet, yes.
One of the things you mentioned earlier was starting out working with Dr. Atkins at his clinic. And his diet is actually the opposite of what, his Atkins diet program was the opposite of what you're talking about. Does a diet that is high in meat like the Atkins diet, is there any evidence to suggest that it actually promotes prostate cancer?
Well, there is evidence that charcoal meat can, for sure. There have been studies like that where, men that over-grill or over-barbecue can liberate some of the hydrocarbons in the food that are carcinogenic. When looking at studies in men that eat more red meat, yes, those men do tend to have higher rates of prostate cancer.
But not more of poultry or turkey or other animal
No, it
products?
doesn't appear to be. It appears to be red meat. Yeah. And it may, I don't know if it's the hormones that are given to these animals or that are getting.
I'm wondering if you had the kind of meat that does where they don't give hormones, and it's grass-fed or whatever, would that be?
That's possible. And, the guys that say, look, I still need that one serving a week, then I say, fine, go organic, and do it that way, if that's what you need. Some men, if they're just taking pure vegetables all week, they lose a little energy, and maybe they need a vitamin B12 shot, or just to make sure that they're not going to go low there, because they become depleted.
So, if someone has a family member, for example, who has been diagnosed with prostate cancer, a male who has like a father or a brother, as you mentioned earlier, is there something that they should be doing early on in their lives to try to reduce their risk for developing prostate cancer?
Well, the one thing they could do is get a baseline PSA. I think that would be important. I think that they have to try and maintain as healthy of a lifestyle with a plant-based diet as best they can. I would recommend checking your vitamin D level, taking things like low levels of, just a multivitamin, which can include things that have Saw Palmetto to keep your prostate healthy, low levels of vitamin E, selenium, the Lycopene, the pomegranate extract. Things like that can all be very helpful. And I think, again, a very healthy diet and exercise.
Okay.
As well, I would probably recommend 1 to 2 tablets a day of the Zyflamend, and maybe 2 tablets a day of the AHCC.
Okay. And is the AHCC, is that available at health food store?
Most of the health food stores it's available, but if not, there's a website. It's Q-O-L. It's Quality of Life Labs. They import it into the United States from Sapporo, Japan.
And I think you mentioned the Saw Palmetto is more important in prevention than actually in treatment.
We use a Saw Palmetto for men that are starting to have some urinary symptoms. I think it can be helpful for those men. If they're starting to notice a decrease in their urinary stream, or they're getting up at night a few more times than they would like, and they're starting to notice a difference, rather than going on to some of the pharmaceutical drugs, that an herbal supplement like Saw Palmetto, pumpkin seed, beta-cytosterols, those things I think can all be very helpful in maintaining the growth of the prostate and reducing the inflammation in the area.
Is the prostate gland a necessary, for people who aren't in the medical profession, is it a necessary organ in the body, so to speak?
It's necessary for fertility. Okay. It provides the proper nutrients for the sperm to fertilize. So there are men that don't. If you have to have your prostate removed, then and you are considering fertility, then you would have to bank your sperm beforehand.
My guest on the show today is Dr. Aaron Katz, and we've been talking about prostate cancer, and because September is Prostate Cancer Awareness Month. So what I'd like to focus on for this last segment of the show is for those of you who don't know what to do, if they're men who are listening or wives of men who are listening, what are the current screening recommendations, Dr. Katz, that men should be going through?
Well, right now, the current recommendations are for any male starting at the age of 50 should have a yearly blood test for the prostate. That would be the PSA test, and then combined with a digital rectal examination. Now, if you are a man out there that has a known risk factor for prostate cancer, and really the two risk factors that we know of right now are that you're African American or that you have a strong family history, either your brother or your father has prostate cancer, then you should be screened earlier, probably starting at the age of 40.
Okay, so once screened, then say someone comes back with that elevated PSA, what are the conventional and alternative things that they should be considering?
Well, one of the things that you want to ask your doctor when you get diagnosed is, how aggressive is my cancer? And he can give you a number, and that number, which is called the Gleason scale, is basically on a scale from 2 to 10, although I'll tell you nobody gets diagnosed under 6. So it's basically 6 to 10. If you're a 6 or a 7, then you may, and your PSA is under 10, you may be considered low-risk prostate cancer patient. And low-risk prostate cancer patient, in my mind, doesn't necessarily need any other tests like a CAT scan or a bone scan, and may not need treatment. Okay, I say may not because not every patient is the same, obviously, and it needs to be discussed, but many of those patients can go on, this active holistic protocol that we outline in the book. For patients that get diagnosed with more aggressive prostate cancer, Gleason 8 and 9 or 10, those are high-risk patients. Those patients, I would suggest that you get a CAT scan and a bone scan to make sure that it's not in the lymph nodes and make sure that it's not in the bone, because if it is in the lymph nodes or the bone, then you probably are going to need to be started on hormone therapy right away, which would be an injection to reduce the male hormone, which will cut off the cancer and put you in a remission. And you could go into a remission pretty quickly, sometimes within 3 months, sometimes 6 months. A remission would be a PSA that's now 0. But I wouldn't have any other treatment until you get into remission, and then you can talk to your doctor about whether or not you should consider additional treatment like surgery or radiation. That's for the high-risk patient. So it really depends, and try to get a handle if you are diagnosed. Are you a low risk, an intermediate risk, or a high-risk patient? And I think that's very important because that will not only determine if you need additional testing, but if you need additional treatment.
So what is this Gleason scale based on?
The Gleason scale, Dr. Gleason was a pathologist who looked under the microscope and looks at the cells. The pathologist looks at the cells and will see how closely the cancer cells resemble a normal cell. The closer it resembles a normal cell, the lower the Gleason, the less aggressive. If the cells look very aggressive, meaning that they don't appear under the microscope like anything like a normal prostate cancer cell would, then the pathologist will give you a higher Gleason number. The higher Gleason numbers are more commonly associated with the cells that will get through the prostate capsule and escape the prostate and get into, the lymph node or the bone.
Does the high Gleason scale then correlate with more aggressive cancers or just some that are farther along in their development?
It correlates directly with the aggressiveness of the cancer.
Okay. After someone has gone on hormone therapy and say they have gone into remission, what is their risk for relapse after that kind of treatment?
Well, it depends. It depends upon how quickly they go into remission, and it depends upon how high the PSA was to begin with. The normal PSA, let's say, well, there is no normal anymore, but let's say, under 10 is considered to be still relatively on the low-risk side. But, if you come in with a PSA of 50, 60, or 100, it's more likely going to be that the disease has already spread beyond the prostate. Just by the PSA alone, if you have a PSA of 100, let's say, you're not going to, let's say, need or you should not have surgery at that point. You should probably just have hormones. Those patients, do have a high rate of relapse based upon the fact that their PSAs are high. But even if you do have a relapse, there are a lot of different hormone therapies that are out now, and there's recently been FDA approval of 3 or 4 new drugs just to fight that relapse. One of them is a chemotherapy drug. One of them is an immune therapy drug that was just FDA approved, where you take out your own blood cells and expose them to a prostate cancer antibody and then reinfuse it into your body and allow your body's own immune system to fight cancer. That's been FDA approved. That's called Dendreon. And so, there are a lot of different ways. So even if the PSA does relapse, it doesn't necessarily mean, a death sentence for the patient. Many of the patients now for prostate cancer, even in those high-risk patients with very high PSAs, can be managed as a chronic illness. But I do want to emphasize before we end that I do believe that even if you go onto hormones or have the vaccine or have surgery or radiation, I firmly believe that diet and supplements can play a role in all those patients.
You've given a lot of hope, I think, for people who may not be aware of some of the, less conventional treatments, that they can actually get better and perhaps not have to go through some of the conventional therapies.
Exactly.
So that's wonderful. And again, I want to just encourage people to look for Dr. Katz's book, The Definitive Guide to Prostate Cancer, Everything You Need to Know About Conventional and Integrative Therapies. And I really want to thank you for being on the show. It's been great to learn more about prostate cancer. I've always specialized in women's medicine, so this wasn't my forte when I was in practice. But thank you again for being on the show.
Sure, thanks for having me. It's been great. Thank you.
I'm sorry to say, but that's all the time we have today, and I want to thank you for listening to The Vital Life, Awakening Your Full Potential. I'm your host, Dr. Carolyn Coker-Ross, and next week we will have Rob Weiss, who's a well-known sex addiction expert. He's been on many national TV shows talking about this subject, and he will be with us talking about sex addiction in the digital age.
You have been listening to the Dr. Carolyn Coker-Ross Show. Please visit CarolynRossMD.com. That's CarolynRossMD.com to access podcasts, show archives, and more about Dr. Ross and her services.